If you're using Open Dental in your practice, today I'm sharing my top efficiency hacks and features when it comes to Open Dental treatment plans. These aren't just theoretical tips. These are battle-tested shortcuts that has saved me and my team thousands of hours and helped me maximize the profitability of my practice. Forget the basic tutorials. I'm sharing my daily workflow using Open Dental treatment plans, learned from a decade plus of using the software, as well as client feedback. For the past 12 years, I've lived and breathed Open Dental software. I built my entire practice from scratch using this platform. But I didn't stop at just using it. We built our own software layer on top of Open Dental called Teamio, which is now helping hundreds of other Open Dental practices optimize their operations and keeps them on the pulse of their financial performance. This isn't meant to be a full-blown tutorial on how to use the Open Dental charting module or the Open Dental treatment plans. But instead, I'd like to share the exact workflows we have in our own practice. And these are the same things we bring up during our Teamio training calls with our client offices. And every time I do this, I'm blown away by the things that the front desk team or even the doctors didn't know. And that's what we're gonna cover today in this part one of the two-part series of videos on Open Dental treatment plans. And to make it even easier for your team, I've included a downloadable PDF, which is a quick practical playbook that gives you actionable steps that's gonna help bring efficiency into your everyday treatment planning workflow. I'll include the link to download the PDF in the description below this video. All right, so here's what we're gonna cover in this video. One, best practices for efficiency when you're seeing patients for treatment planning. These are things you can do to speed up your workflow, especially when it comes to entering patient treatment into their chart. We'll also get into things that's gonna help you minimize the delays of claims getting paid when it comes to insurance patients. And remember, these are not things that you're just gonna learn from reading the Open Dental manual, but these are things that you pick up from using the system for the last 12 years, day in and day out. You make mistakes, you learn from them. So I'm basically taking the best practices that I've learned in the last 12 years and hopefully covering it in the next 10 minutes. All right, second is time wasters. These are things that are nice to have, but don't really need because they waste your time. Every piece of software comes with some feature sets that are nice to have, but in everyday practical routines, it doesn't really have real utility to it. And I bring this up because when we speak with our client offices, lots of them are entering information into the patient's chart, which may be unnecessary. And when I ask them about it, how they're utilizing the information, they don't really have an answer for it. And in fact, they rethink their decision why they're even doing it in the first place. By the way, if you're new to this channel, my name is Neil Shah. This is where I share what I'm doing in my own practice, running the everyday business operations. I share what's working, what's not working, my wins and losses. And if you'd like to stay updated on this type of content, please feel free to join our newsletter over at dentalstartupacademy.com. I will share the link below this video for those of you who believe in taking action. All right, let's dive right in. Every piece of software comes with features that help you become more efficient or helps you gain speed in your everyday workflows. Over the last 12 years of using Open Dental in my own practice, I've changed how I use it. I've learned things over time that's helped us become more faster and has saved a lot of my team members' time in the office. One of these is missing teeth. One of the first things I do when we're seeing a patient for a comprehensive examination is mark down missing teeth. Of course, this isn't something new. We've learned this in dental school. That's what you're supposed to do. But in Open Dental, it helps with two things. One, when you mark patients all missing teeth, when you go to do the perio charting for this patient, it automatically marks these teeth to be skipped instead of you having to manually mark them to be skipped. So that saves everybody's time. Second, it's also going to help you when you're writing up narrative reports when it comes time to submitting for claims or pre-authorizations. For instance, some plans will ask you for all missing teeth in the upper and the lower arch if you're submitting either a claim or pre-authorization for a single unit implant. If there's a tooth or multiple teeth that you do plan on replacing with either fixed bridge or implant work, I always ask the patient the dates of extraction if they were not done in the office. You could always call up the insurance company to see if they have on file any extraction history for a specific tooth for that patient. And we write all this information down in the little note box right below the tooth chart. So you're gonna include the tooth number and the dates of extraction. So marking all the missing teeth and the dates of extraction of all the teeth that you plan on replacing will save you tons of time down the line. So why is this even important? For example, if you're sending in a claim for a patient who you've just placed an implant on, for some plans, it may be okay to just have a post-operative PA that shows the implant placement. But for some plans though, they will ask you for all the missing teeth in upper and lower arches, as well as the dates of extraction of all the teeth that you're trying to replace with either a fixed bridge or implant. And all of this back and forth will delay your claims from getting paid, sometimes 30 to 45 days from the date of service. So you can avoid all of this just by getting into the habit of writing down all the missing teeth and writing down the dates of extraction for all the teeth that you're planning on replacing. All right, moving on. Another thing that helps in your daily workflow, especially when you're dealing with an insurance patient, is that when you're treatment planning and you notice a patient needs to have their crown or bridge work replaced, you need to ask the patient previous dates of history for the crown or the bridge work that you're trying to replace. If the patient has a new insurance plan and there's no prior history, then these dates don't really matter. And I usually stick to the rule of putting in an approximate date of 12/20/2000. But if the patient has had the same insurance for a long time and now you're seeing the patient from another practice, and the patient doesn't remember the prior dates when the crowns or the bridge work was done, it's probably a good idea to call up the insurance and get the dates of history for the crown or bridge work or whatever it is you're trying to replace, especially when you're trying to consider the insurance reimbursement for that specific procedure. Because for example, if the crown or the bridge work was just done 4 years ago and now the patient is seeing you in your office and you're trying to replace that crown or the bridge work, well, the insurance is not going to reimburse anything towards that procedure if they have a 5 or a 7-year crown replacement rule. And if you didn't know this information, you're going to be quoting the patient wrong out of pocket because you're assuming that there's going to be insurance reimbursement for that procedure when you really don't know whether or not there's going to be a reimbursement. So in open dental, whenever you treatment plan for a patient a replacement of a crown or bridge work, you need to go in and put in whether it's an initial or a replacement appliance. And then if it's a replacement, you should get in the habit of putting in the date, a prior date of history for that specific procedure. If you're treatment plan, for example, if you're treatment planning a 4-unit bridge, you have to do this for each of the units, the retainers and the pontics, and put it in as whether it was each of the unit was an initial or a replacement, and then put in the date of the replacement or prior history date. And the same thing applies for night guards, partial dentures, and complete dentures because most plans have frequency limitation for these procedures. All right, let's talk about the charting process and where you can gain speed. In the chart module of Open Dental, there are procedure buttons which allow you to quickly add procedure codes to the patient treatment plan or chart. When you first install Open Dental in your practice, it comes with some default ones, but you can then go ahead and create custom ones for the most commonly procedures that you do in your practice. For example, I've set up lots of procedure buttons for the most commonly done procedures that I do in my own practice. So for instance, I've got a procedure button for extraction and grafting. I've got another one for surgical extraction, grafting, and a resorbable membrane. And I've got another one for extraction, grafting, and a non-resorbable membrane. Without these buttons, what I would have to do is click the tooth, then put in separate 2 individual codes, one for extraction and one for the grafting. But now with these procedural buttons, what you can do is just select the tooth, click the button, and it will automatically insert either 2 or 3 codes that I need. And you can set this up for things like crowns. So if I click the procedure button for crown, it will not only insert the code for the actual procedure code for a crown, 2740, for example, which is an all ceramic crown, but it will also insert a crown insert code. Now, you may have created custom codes in your practice. I've created ones for crown inserts, bridge inserts, etc. So the crown insert code can be attached to the patient's next appointment at which time they're coming back to receive the crown. You can also do this for things like partials. Since partials involve multiple visits, you can create a procedural button that will automatically insert custom codes you may have created for the different types of visits for the partial. For example, custom tray, final impression, teeth trying, and then final insert. So when you have a patient sitting in your chair and you treatment plan a partial, just by clicking this one button, it will insert all the custom codes you've created for all the different stages for that partial or the complete denture, or for any other multi-visit type of procedure that you may do in your practice. The additional advantage of doing it this way is that if you have auto notes set up and you have the correct procedure code attached to that patient's appointment, and when the patient is checking out and your front desk goes ahead and marks the appointment completed, it will automatically insert the right procedure note for that procedure. And then you can have your doctors go in and edit the note if necessary. But this whole process saves everybody a ton of time, especially when you're dealing with lots of patients back to back. And you're probably thinking this is very basic, but as basic as it sounds, there are lots of offices who don't even attach procedure codes to completed appointments. And why this is, it blows my mind. But the combination of quick procedure buttons and the auto notes will save everybody a ton of time, especially when you're seeing lots of patients back to back. and if you've got multiple providers in the office seeing lots of patients. All right, let's keep going. One of the most underrated features of Open Dental is planned appointments. What it allows you to do is essentially create an order of appointments, which don't have to be scheduled. The point is, when you've just finished treatment planning a patient with a bunch of procedures, and if the patient is to come back for any work, by creating a planned appointment, you're telling Open Dental when they come back for their first visit, what's going to be done in that appointment, meaning what procedures, and how long that appointment is going to be. And you can create more than one planned appointment. If, for instance, you've treatment planned a patient for a bunch of procedures and the patient leaves the office without scheduling anything, if you created planned appointments and marked down what's supposed to be done in the first visit, like what procedures are to be done and how long the appointment is supposed to be, and if and when the patient calls back to schedule an appointment, your front desk, and in fact, anyone in the office who has access to Open Dental will know exactly what this patient is supposed to get done in that first visit, meaning what procedures are to be done and how long that appointment is supposed to be. So in fact, planned appointments are a great communication tool that streamlines your workflow all the way from creating treatment plans all the way to getting patient scheduled appointments. In my practice since the beginning, we have a general rule that I follow and everyone in the office follows, that if there's any treatment in the patient's treatment plan, there's at least one planned appointment created in the patient's chart. If the patient leaves the office without scheduling any appointments after having presented a treatment plan, there's an immediate follow-up created on Teamio to follow up with this patient at a predetermined date, and it's assigned to a specific person who is responsible for maintaining the schedule. So basically what I've done is, I think of it as a brain dump. I don't have to remember to create a post-it note. I don't have to create a blockout on Open Dental to remind somebody, or I don't have to remember to ask a specific team member that, hey, did you follow up with patient so-and-so? But instead, there's a specific system that basically has a task assigned to this particular team member. So when they log in on that particular date, they're gonna know exactly who to call and what they're supposed to call for. And this has been such a great system for us in all of our client offices, because this is exactly what prevents patients from falling through cracks. And what you've done by doing this is you've created accountability for your team. You've assigned a task to a specific team member to follow up with this patient. And when they go to follow up with this patient, they're immediately going to see that, oh, there's a planned appointment for this patient, because we'll pull that information directly from Open Dental. So having these kind of systems not only helps for training, but also helps keep the schedule full. All right, let's move on to the second thing I mentioned in the beginning of the video, which is the time wasters. Every piece of software comes with features you probably don't ever use. The features are there because some offices use them. You may have used it in the beginning, but then later you realize there's better ways to do things and maybe no need to do it at all. So instead of going through this process and later realizing why you wasted your time, I made this so you can fast forward, learn from my experience, so you don't waste your time like I did. And for me, one of those things is marking existing conditions and restorations the patient has. When you see a new patient in your practice and you're doing a comprehensive exam, and you notice the patient has a restoration on every single tooth in the mouth. This may be a crown, filling, bridge, whatever it may be. Why is it so important to mark down every single tooth and the restoration on which surface for each tooth? I know we were trained this way in dental school, but I consider this to be one of the biggest time wasters in private practice. One argument could be that, well, you need to track this data over time so you could tell what was done in your practice. Well, technically, you could look this up immediately just by looking in the patient's chart or in the software. You can even go back to the first set of x-rays that you did for the patient before you did any work on this patient in your practice. And in fact, I bet not a lot of people even care to look at this data over time. If I'm going to be working in an area, for example, the upper right area, and I'm working on tooth so-and-so and replacing existing amalgam restoration or replacing an existing crown, I'm going to write in my clinical notes that I'm working on tooth so-and-so, that I removed the existing amalgam restoration, that I excavated the recurrent caries, that I cut the old crown off on tooth so-and-so. So I'm writing this information down in my clinical notes anyways. And of course, there are times you do need to note down information prior to you moving forward with any work on the patient. For instance, you need to know that if you're replacing a crown on a patient, when that previous crown was done, because if the patient has insurance and the insurance covers the crown only every 5 years, you do need to know when the prior crown was done. Same thing applies for extractions. Like for example, a patient comes to your office for implants and the extractions were done at another practice. I'm going to ask the patient when the previous extractions were done and whether or not any bone grafting was done. But I don't care for the dates of their wisdom teeth extraction because it doesn't relate to anything I need to do for that patient or that I'm diagnosing on the patient. And I don't care to mark their existing MODL on number 14 because there is no work required on that tooth. All right, let's keep going. Speaking of time wasters, marking tooth movements into patient's chart also seems too time consuming with little to no benefit. Open Dental allows you to document teeth shifting, rotation, and tipping. They have this nice interface where you can select one or more teeth, and entering the tipping or the rotational degrees, the teeth will actually display on a nice graphical chart. But I've never really found this to be helpful. I could easily just write into the patient's chart, number 30 is mesially tilted. Or I could just look at the panel x-ray and I would know this information right away. But sure, I can understand why you may need to note down that number 30 is mesially tilted at the time you first saw the patient, and you're probably gonna note this information down somewhere in the chart. But even then, I've never really found the need to go back to this information when I'm talking to the patient or working on the tooth. All right, I think that's it for time wasters. Remember, the goal of efficient treatment planning isn't just to save time. It's to create a seamless experience for your patients and to reduce stress for your team. I'd love to hear about your experience with Open Dental, or if there's any tricks or hacks or tips that you've discovered, drop them in the comments below. Thank you so much for watching. Take care.